Okay. Hi, Pat. So I have a few questions for you today for your part of your clinic visit. Start at the top. So, how's your blood pressure been? Yeah, that looks good. And have you any swelling in your ankles? Oh no, that looks great. Yes, fabulous. Have you no dizziness?
No.
Okay. Bowels.
Regular.
Okay. Your exit side. Your exit side's good.
Good, but
Okay. Good. Okay, that's all I have to ask you today, Pat. The doctor will be in pretty soon to see you and finish your clinic visit. Thank you. Hi, Pat. My name's Chris, and I'm going to do your clinic today, just to make sure that we can address some of the needs that you might have. Is that okay?
yes, it is.
Okay. So tell me, what's your biggest concern today? And if we could address one thing, what would that be?
Well, I don't have too many concerns. I think everything is okay, but I don't really know very much about PD or peritoneal dialysis, so it's overwhelming right now for me, and I don't know whether that's normal or what's normal and how I should really be feeling.
Okay. So is it okay if I ask you a few more questions?
Sure.
Okay. So I'm curious then, how is peritoneal dialysis fitting into your home life?
Well, it's been a life-changing situation, that's for sure. I feel like I'm doing something about my peritoneal dialysis all day long. Mm-hmm. I'm thinking about it before I start, and then when I'm finished, I think about when I have to do it again. So it's I'm having a little struggle fitting it into a routine, but I'm getting there, but it is overwhelming.
And I mean, it's good that you're so focused on PD, but it takes time to work through things. And change is never easy, but it will get a little easier as time goes by.
Okay.
So I know that your husband is helping you with some of your PD. How's that working out for you?
Well, we're getting a system. It's okay. He does help me with getting the bags in shelves and picking up, getting the boxes organized, and also he is in the room and he sort of prompts me if I miss something. Okay. But I am independent and I like doing it myself.
Good for you. So it sounds like you found a way to work together as a team. That's great. So who does your exit site dressing?
I do my own.
Okay. And how often are you changing that?
When I take a shower, which is about every 2 days, or whenever I take a shower, I do it myself. My husband is not comfortable with doing something medical like that.
Okay. And what does your exit site look like?
Sometimes there's a bit of crusting, but I think it looks okay.
Okay. Does it look like any of these pictures that I'm going to show you here?
It's not red around it, actually. I'm going to point to this one.
Okay. So that's excellent. That's a perfect exit site. Sounds like you're doing a really good job with your care of that, Pat. So are there any other difficulties that you're having when you're performing your peritoneal dialysis at home?
There's only one thing, because everything else seems to be okay. But when I finish draining, at the beginning of that first fill, there's a sharp pain that actually makes me jump. And it doesn't last very long, but it's there at the beginning, and I just don't know whether that's normal or not.
That's a common complaint. It's called fill pain. Okay. I have a couple of suggestions that we could go over with you about that. So when you are filling, instead of filling completely, having the roller clamp wide open, just have the roller clamp half open. Once you've filled up a little way and that pain has kind of, gone away, or when it usually goes away, then you can open it full. Do you want to
Sure. That sounds like a good idea.
Okay.
So instead of opening it all the way, I just do it half the way.
That's correct.
And then I can open it up later.
Yeah, and let it all go in.
Perfect.
Okay, that's great. How about you give it a try for a few days? Maybe give me a call Wednesday and let me know how it's working out for you.
Okay, I will.
Okay, so tell me about your dialysis prescriptions. What solutions are you using?
I am using 3 bags of the 1.5% and a 7.5 overnight.
And how do you decide what solutions you're going to use each day?
Well, right now I'm really not deciding. I'm just following what the training nurse told me. I'm a little mixed up as to how to choose.
So I see that you've brought your log sheet with me, so can we take a look at that? So your blood pressures, how have they been?
I think it's within normal range, but it does tend to go up and down a little.
So following your blood pressure and your weight daily is a way to choose your solutions. So maybe we need to spend a little time going over this again. So how about when your clinic is all done, then we'll do a review on choosing solutions later this afternoon.
That will really help because I've found that to be very confusing. So thank you.
So I'll come back in a little while when the doctor and the dietitian have seen you.
Okay, good.
Thanks, Pat.